Let's talk about supplements, the use of supplements. Supplements are also useful in the management of high cholesterol levels. In this video, I will be talking to you about other ways by which you can lower high cholesterol levels, other ways by which you can manage and reduce your cholesterol levels. Anyone with abnormal levels or high levels of cholesterol is at increased risk of developing a heart disease, a stroke, peripheral vascular disease, and even type 2 diabetes. All these medical conditions can be prevented as they are actually complications of high cholesterol levels. Having a diagnosis of high cholesterol levels shouldn't make you sad or depressed. It actually means that you need to have some changes in your lifestyle. So here are some ways by which you can manage high cholesterol levels to normal levels. Take note of these things. One is to engage in more physical activities. This will help a lot in lowering your cholesterol levels. Exercise actually helps to lower the bad cholesterol, which is LDL, and helps to increase HDL, which is the good cholesterol. So when you get involved in brisk walking, at least for 5 days within a week, for 30 minutes, get involved in cycling, you can swim, you can also get involved in skipping. Skipping, a form of exercise that can help in lowering your bad cholesterol and increasing the good cholesterol. Next is to apply some lifestyle changes. For example, if you drink alcohol puts an individual at risk of developing high levels of cholesterol because alcohol broken down by the liver to produce cholesterol and triglycerides, and high levels of these puts you at risk of those complications mentioned earlier, like risk of a heart disease, a heart attack, and even a stroke. Aside that, risk of peripheral vascular diseases and type 2 diabetes. So when you reduce alcohol intake, you limit your risk of developing these complications, and then you can have your cholesterol levels lowered and within normal limits. Other lifestyle changes that you can practice include deep breathing exercises. You can engage in deep breathing exercises, also a way of managing stress, as this will help to reduce high levels of cholesterol. So you should learn to relax, you should learn to take a break, you should learn to meditate, and this will help you a great deal. It is important to note that there are majorly two sources of cholesterol. Cholesterol usually produced by the liver and through your diet. These are sources of cholesterol. It's important to also note that your dietary intake determines your level of cholesterol. I did a video on how modification of your diet can help in managing high cholesterol levels. You can check out the video here or there, watch it, and you will learn how your diet can be improved to help in managing high cholesterol levels. The third thing to consider is the use of medications. Usually when your doctor diagnoses high cholesterol levels, he will recommend these things to you and may give you medications to control your cholesterol levels. So such medications like statins may be helpful. There are other classes of drugs that can be used. They help to clear the high levels of cholesterol from the liver, from the blood, from the vessels, and help to increase good cholesterol levels. That's the HDL. So if you have been placed on medications, follow your doctor's advice on this. Apart from clearing the bad cholesterol and increasing good cholesterol, they actually help in absorbing this bad cholesterol so that they are not high enough in the blood, and prevent that from clogging your arteries to prevent risk of stroke or a heart attack. Next and finally is the use of supplements. Yes, there are some supplements that are good for lowering high cholesterol levels. Now, it is important to note that omega-3 fatty acids are good for lowering cholesterol levels. So also some other supplements that contain plant sterols are also useful. But in taking any supplement or any medication for that matter, you should consult with your doctor. You can take this along with you to your next clinic appointment or contact your doctor for proper evaluation and recommendation. Even though cholesterol is important and useful in your body for different functions, abnormal and high levels of cholesterol puts you at risk of developing certain medical conditions such as a heart disease, a stroke, peripheral vascular disease, and even type 2 diabetes. Hence, it is important to ensure that your cholesterol levels are within the normal range recommended for you as a man or as a woman.